Hello, future doctors. Today we're tackling hypertension, the silent killer. Most people with hypertension feel fine, but the condition quietly damages vital organs. Hypertension is the persistent elevation of blood pressure in your arteries. Blood pressure is the force of blood pushing against artery walls. Too much pressure strains your cardiovascular system. We diagnose hypertension using two numbers, systolic, top, and diastolic, bottom, measured in mmHg. Normal is less than 120/80ths mmHg. Stage 1, 130, 139/80ths, 89. Stage 2, 140 plus/90 plus. Isolated systolic hypertension, high systolic, normal diastolic, is common in older adults due to stiff arteries. This pattern is risky and needs careful management. Recognizing and treating hypertension early prevents heart disease, stroke, and kidney failure. Mastering this topic is essential for your medical career. Let's dive deeper into the types and causes. When diagnosing hypertension, ask, why is it happening? Over 90% of cases are primary, essential hypertension. No single cause, but genetics, age, obesity, high salt, and inactivity all play a role. Lifestyle modification is key for these patients. Secondary hypertension, about 5–10% of cases, is due to another condition, like kidney disease, sleep apnea, or endocrine disorders. Treating the underlying cause can cure the hypertension. Suspect secondary hypertension in young patients, sudden severe cases, or those unresponsive to standard meds. Remember the mnemonic ROPE: renal, obstructive sleep apnea, pheochromocytoma, primary aldosteronism, endocrine. Always consider secondary causes if the clinical picture doesn't fit. Blood pressure equals sign cardiac output x systemic vascular resistance. In hypertension, one or both are elevated. High cardiac output in the young, increased resistance in older adults. The renin-angiotensin-aldosterone system, RAAS, raises blood pressure by constricting vessels and retaining salt and water. Overactive sympathetic nervous system increases heart rate and vessel constriction. Endothelial dysfunction, often from smoking, diabetes, or high cholesterol, reduces vessel relaxation, raising resistance. These mechanisms combine to keep blood pressure high. Understanding them guides effective treatment. Untreated hypertension silently damages key organs. The heart high pressure thickens the left ventricle, LVH, raising risk for heart failure and heart attacks. The brain hypertension is the top risk factor for both ischemic and hemorrhagic strokes, and can cause vascular dementia. The kidneys high pressure scars, glomeruli, leading to chronic kidney disease and eventually kidney failure. The eyes hypertensive retinopathy, visible changes in retinal vessels, signals broader vascular damage. These complications are often silent until advanced. Early detection and control are critical. That's why aggressive management matters. Diagnosing hypertension requires multiple accurate readings, ideally including home or ambulatory monitoring. Lifestyle changes are the foundation. DASH diet, less sodium, more fruits and vegetables, regular exercise, healthy weight, limit alcohol, and quit smoking. If lifestyle isn't enough, medications are added. Thiazide diuretics, AC inhibitors, ARBs, and calcium channel blockers are first line. Target blood pressure below 130/80ths mmHg for most patients. Let's test your knowledge. A 68-year-old man with 152/78ths mmHg on 3 visits. What's the diagnosis? Isolated systolic hypertension. A 25-year-old woman with 160/100ths mmHg, resistant to 2 meds. What's next? Investigate for secondary causes. Mastering hypertension will make you a better doctor. Keep reviewing these essentials. You've got this.